Welcome back. In your morning medical news, a health alert for protein powder users. A new study reveals dangerous heavy metals in many popular protein powders. Researchers found high levels of lead and cadmium, with the worst results in plant-based, organic, and chocolate-flavored products. Both metals are toxic, affecting organs, breathing, and reproductive health. Experts stress no amount of lead is safe. The Clean Label Project tested 70 brands, but hasn't named the brands yet. Being able to provide blood to trauma patients is critical to help keep patients alive and stable as they make it to the hospital. But providing that blood to patients while out in the field or in an ambulance may provide challenges of their own. Dylan Thomas shows us how one medical provider is using technology commonly used in the military to provide blood to patients and help save lives.
For decades, the military has been administering whole blood to soldiers that are severely injured in battlefields, as it has been proven to increase the likelihood of survival. Now that very practice has made its way to northern Colorado. Inside battalion chief vehicles for Thompson Valley and UC Health ambulances in northern Colorado, an expensive new tool is now changing the way paramedics treat trauma patients.
This will warm an entire unit of blood within just a few minutes, working very similar to a tankless water heater.
Historically, before arriving at the hospital,
when people are suffering blood loss, we've been treating that by trying to replace it with salt water, normal saline, and it doesn't provide anywhere close to the benefits that people need.
Whole blood has proven to be critical for increasing survival rates for those experiencing trauma.
The majority of our patients in trauma actually die in the pre-hospital setting.
So why wait to administer it until the patient arrives at the hospital?
Get that IV, I'll start working on the blood.
Every minute that we can get blood to them sooner means about a 1 to 5% improvement in mortality.
Whole blood has the components of clotting factors and oxygen carrying components that people need to make better recoveries.
Which is why these EMS providers are now taking O-positive blood to the scene of emergencies. Frozen whole blood will be warmed to body temperature and administered on scene.
It's about time. Yes.
Those are all lessons that we've learned over every conflict since World War I. If we're going to make a big difference in our outcomes in trauma, it's by working in the pre-hospital setting.
Even though this practice has been proven to help save lives, Medicare refuses to cover the bill for it, which means that private companies that provide insurance also are refusing to do the same. UC Health's fund is now covering this bill out of pocket, but health advocates are asking Congress to make a change so that this service will be more equitable across the nation.